Only days ago, the Sinulog Festival had Cebu City streets brimming with color. Today, due to a coronavirus scare, many people in the streets are wearing masks. One suspected case of infection involving a visiting Chinese boy has residents anxious, but the health department insists there's nothing to worry about, at least not at this point. Jem Avancenia has this report.
There was an initial state of panic in Cebu City after the health department confirmed that a 5-year-old Chinese boy from Wuhan, China, who arrived in the city last January 12, tested positive for a different strain of coronavirus. The kid, upon arriving, already had symptoms of upper respiratory tract infection, and so he, together with his mother, were immediately quarantined at the Chonghua Hospital. When news broke out, residents here started wearing masks.
Nabalaka kayo karon kami may tungod anang coronavirus. Well, we are wearing mask to siguro ingon ana to protect that virus.
Nabalaka kay basin og kanang kuan kanang katap diri sa atong aba kay nya wala ta kahibaw nga kuan siya. Makatakod. Luoy sad kay uban mga pasyente or mga kuan nga natakdan ana ba.
The Department of Health Region 7 clarified the case is not yet alarming, but said they are not letting their guard down.
All viruses are self-limiting. Meaning, kung self-limiting, it will only infect you for 3 to 7 days, the most. Now, the problem with viral infections is they tend to be ubanan sa mga bacterial infection.
The kid and his mother remain in an isolation at the Vicente Soto Memorial Medical Center.
The mother is free of any symptoms to really spare her of the problem. And the child now is also recuperating, meaning he is not anymore displaying any symptoms of the infection.
Passengers who were on the same flight with the victims were put under DOH's strict monitoring. The agency also guaranteed the public that it is prepared in the event of an outbreak, with its Bureau of Quarantine already on heightened alert.
To really be vigilant in all incoming flights and passengers, especially those with history of passing through Wuhan. We also have thermal sensors. They have with them, of course, the thermal scanners, and they have also been instructed to really observe.
Authorities, however, reminded the public to maintain good health by observing proper diet and personal hygiene. In case of symptoms pointing to upper respiratory tract infection, the health department advises immediate medical consultation. For News 5, Jem Avancenia, We Are One News.
In China, the death toll from the Wuhan coronavirus outbreak has risen to 9. That is out of 440 confirmed cases. All the deaths were recorded in Hubei province, home to Wuhan City, from where the new virus is believed to have originated.
疫情传播途径以呼吸道传播为主，病毒存在变异的可能，疫情存在着进一步。
那么众所周知，2003年的
Cases have spread to other Chinese cities, including Beijing, Shanghai, and Macau, as well as beyond China. There are suspected infections in Thailand, South Korea, Japan, Taiwan, and the United States.
He was hospitalized, and we're very happy to say that he is in satisfactory condition, and as of this moment is being is very helpful in us identifying particular people that he may have been in contact with.
Airports around the world have stepped up screening of travelers from China. Hong Kong's Cathay Pacific Airways is now allowing its cabin crew to wear surgical masks when on duty flights to mainland China. Passengers to Wuhan are also being accommodated for requests to change or cancel flights without charge until February 15. And for all of that, it is still possible that the 5-year-old Chinese boy who has been quarantined in Cebu after he displayed symptoms consistent with that associated with the Wuhan coronavirus might not be a carrier at all. But the health department says it is not taking any chances, especially as celebrations and travel for the Chinese New Year nears. Greg Gregorio has the story.
It may not be the Wuhan coronavirus after all. In their latest assessment, the health department said the 5-year-old boy from China, who has been the subject of their investigation, is now getting better. The child, suspected of carrying the novel coronavirus, no longer has fever, although his cough persists. This, said Health Secretary Francisco Duque, might indicate that this is not a case of the 2019 nCoV.
Lagnat is a sign of infection. Your body is, yung antibodies mo, unti-unti nananalo yung sundalo ng katawan mo.
But the kid remains isolated in Cebu as the DOH awaits the results of Australia's lab tests on the boy's specimen. For the meantime, Duque urged Chinese nationals coming to the Philippines from Wuhan to have themselves tested.
If they have fever, then they have to be isolated. They have to be worked on, investigated further, and tested for the possible novel coronavirus.
An influx of Chinese nationals from mainland China is expected this Chinese New Year on January 25, especially in the town of Binondo. A barangay official advised residents and those planning to join the celebration in Binondo to wear face masks.
Para lang to make sure na hindi tayo mahawa na mga may nakadala ng ganong sakit. Kasi sa dami nga ng araw, sa dami ng tao sa 25, hindi mo mahulugan ng karayom yung hongpin.
The DOH admitted that there are still blind spots about the Wuhan coronavirus. For now, all they can emphasize is the need for proper hygiene.
Ang simpleng paghuhugas ng kamay, ang laking tulong yan para maibsan o maiwasan ang paglipat, hawaan ng mikrobyo o ng virus. At huwag magsusubo lang kung ano-ano na madumi ang kamay, lalo na ang mga bata.
Well, there are no travel bans at the moment. Airport officials are on full alert status, with Civil Aviation Authority of the Philippines reactivating its communicable disease preparedness procedures. For News 5, Greg Gregorio, we are One News.
And with this new virus spreading, information should be one of our most important shields. So here is a little bit of information on the new coronavirus that is widely spreading in China and other countries. First off, the new coronavirus was derived from the Latin word corona and from the ancient Greek term koron or garland. This is because under an electron microscope, the image of the virus looks like a garland or a wreath. There are now 7 strains of the coronavirus, the Wuhan coronavirus being the 7th, but not all its strains are dangerous or deadly. The 4th strain only causes the common colds. The ones on the right column are the more dangerous types, while the ones on the left are benign. These 4 might result in upper respiratory infections like common colds, as we said, headache, cough, sore throat, and fever. It may also result in pneumonia or bronchitis. One of the more dangerous is SARS, or the Severe Acute Respiratory Syndrome, which in 2003 infected China and 26 other countries. 8,000 people were diagnosed with SARS, 10% of whom died. It also has flu-like symptoms and might result in pneumonia, heart or liver failure. But the 2012 coronavirus or Middle East Respiratory Syndrome was much more deadly. It developed in the Arabian Peninsula with 2,000 infections, but it had a high fatality rate. More than 3 out of 10 died because of MERS. And the latest now, what we're talking about is the novel coronavirus, which started last December. This came, supposedly, they suspect, from a seafood market in Wuhan, China. It then spread to Thailand, Japan, Korea, and now there is at least 1 case in the United States. And because of the new strain, various countries are scrambling to implement quarantine procedures. The problem is the incubation period for the virus can take up to 2 weeks, which means carriers might spread the virus even without recognizable symptoms. But the DOH assures the novel coronavirus is not as threatening as SARS or MERS. On the other hand, there is no vaccine for this virus, much less a facility to handle it. All diagnoses are done in a medical facility in Australia. So how do we fight this? DOH advises and reminds good hygiene is simple, basic, and it works. From covering your mouth when coughing or sneezing to washing your hands. If symptoms are showing, consult a doctor.